Hi, I'm Kym Ward, Dementia Project Coordinator at the Brain Charity. The Brain Charity has been running music-based therapy workshops for people living with dementia since 2019. These combine singing and speech and language therapy and physiotherapy and dance. Prior to March 2020, we were out in daycare centres, in care homes, in community centres and in assisted living facilities running these workshops. But then quite early on in March, we realised that we had to stop for this health and safety really of our most vulnerable service users. With a view really to thinking, we'll be up and out, back out there in a couple of months' time. After going into lockdown, the Brain Charity started to hear from its service users that they were struggling with food, they were struggling to do the shopping. Either that was because they were shielding and they couldn't leave the house, or because they were starting to see an impact on their finances. So the Brain Charity pivoted its services and we started to run a Meals on Wheels food delivery service. We're a small team at the Brain Charity and it was really heartwarming to see how everybody just banded together, used their different skill sets and then managed to support over 63 households in the wider Merseyside area between the period of March 2020 and August 2020 when we wound the service down. During that time we saw how much more carers were doing really to support people with different conditions, neurological conditions. And so we tried to recognise them during Carers Week. We put together a tiny package of bath smellies and chocolates, and then we, as part of the delivery service, we dropped them off at people's houses and they were made up. It just makes a difference when people know that even though it is harder and it is a bit more difficult day to day, that they're seen and they're valued, and that somebody out there is saying, we recognise what you're doing. And we were happy to do that. I mean, the Brain Charity is there for all of our carers as well as the people with neurological conditions that we support. And then as the months progressed, we were able to put many of the services which we'd offered in-house online. And so people were able to contact and connect in that way too. We did see during that time that people were struggling with the technology, especially if you've got a neurological condition. It's not always easy. It's not just as simple as navigating, clicking, getting through, because the channels that you've used before are those channels which you feel comfortable with, feel safe with and understand how they work, and so it was leaving some people behind. I mean, one of the things that we've learned over the last months is that there's no one size fits all solution to transferring to online services. You know, some people are going to need way more support and scaffolding work, and some people are going to manage quite well. And this was certainly true for our music-based therapy workshops for people living with dementia. It radically changed the field of how we can offer this service. And so over the course of those months, we decided, with input from our service users, to turn the workshops into a video series, which was then released week after week. Rather than going online and doing a course on Zoom, which we felt would be less accessible for people living with dementia, who can then use the videos and have them on repeat, or the carers can access them whenever they need rather than whenever the course is on. We've had hundreds of people sign up to the Music-Based Therapy email series, and that's wonderful. That's exactly what we wanted. And although we've all learned to cope with the new realities that we're faced with, and those kind of uncertainties, one thing that's really important is to continually try to think about how to adapt our services in ways which meet the needs of the service users, so that we don't leave anybody with a neurological condition behind.